Jessica, and we're both students in the Certified Nurse Midwifery program at the University of Colorado College of Nursing. Our objective of this video is to share evidence-based interventions and tools to provide comfort and support to women during normal physiologic labor. As midwives, we know that labor is hard work. Evidence continues to show us simple and impactful ways to support a laboring woman to improve her outcomes and overall birth experience. Labor and birth is a time of transformation, and women need to know that they are safe and cared for throughout their labor. We will share some ways we support women in our labor practices, and we think that the women you serve will really enjoy them in your clinic too. In fact, I just gave birth to my third child and personally benefited from many of these labor support techniques during my midwife-attended home birth, and I've included several clips for you to see. The birth photographer I work with also generously contributed footage from other births and has given us permission to share them as well. One of the easiest evidence-based ways to support a laboring woman is to be present with her. She should never be alone. The presence of a compassionate and supportive partner, friend, nurse, or midwife have been shown to create a more positive birth experience for the birthing mother. And according to studies, women who had continuous labor support experienced shorter labors, increased rates of spontaneous vaginal delivery, and decreased rates of intrapartum analgesia, operational vaginal birth, and cesarean deliveries. The woman is there with her partner or family. The midwife's role is to offer information, encouragement, and support to them as well. She can share comfort measure techniques and explain or demonstrate what to do. Your role is to hold space for the woman by making her feel safe and cared for. So basically, the most important intervention you can do in labor is to stay in the room and listen to your patient and meet her needs. The next intervention is positive affirmations and emotional support. Labor is hard work and language is powerful. Women need to be reassured that they are capable, strong, and safe. They also need to know that everything is okay and normal. In the following clips, you'll see examples of midwives and family members giving laboring women positive affirmations.
Inside, find your power. You can do this. Come on. You've got what it takes. This is your power.
Do it.
Okay. Another way to encourage her is to let her know a break is coming. In between contractions, her pain will usually go away completely, and she can be reminded to enjoy these pain-free minutes and maybe even encourage her to laugh and smile.
Here are a few phrases in French that are just words of encouragement for women in labor. Tu es forte, tu as la force, bon travail, tout va bien, ça va aller, c'est le chemin, fais confiance.
It is okay to say these words over and over again. For a woman in labor, repetition can be soothing and helpful. Another technique is visualization. You can encourage the woman to close her eyes, take a deep breath, and imagine she's in a calm and safe place. You may also tell her what to visualize is happening in her body, such as your baby's moving down, your cervix is softening and opening. Remember to communicate with the family what is happening and why, as they may be concerned if they've never seen normal labor before. Additionally, always ask your patient permission before performing any medical procedures, such as a cervical exam or starting an IV. Finally, when your patient is not coping well at all and she wants to give up, this is when you will need to use the Take Charge routine to help her pass through this difficult time, which is usually during transition. Your voice should remain calm and encouraging. Stay close by her side. Your touch should be firm and confident. Anchor her, hold her shoulders or her head in your hands, gently yet firmly. Tell her to open her eyes and look at you. Say it loudly enough so that she can hear you, but calmly and kindly. This will help break her out of her fear and into your guided support. Guide her in patterned breathing and encourage her every breath. This will get her out of her panic and back in control. Another helpful intervention to support laboring women is to create a soothing environment for her. Often, when a woman arrives at the birth center in labor, her contractions may space out or stop. This can be related to leaving the comfort of her own home and encountering a change in the environment. Making sure she feels comfortable in her surroundings can help her relax and encourage her body to continue the labor process. Note how relaxed these women are in their home environment and think about how you could create something similar in your birth center. Turn off bright lights and use soft or natural lighting. Try to keep traffic in and out of the room to a minimum. Try aromatherapy. You can use a diffuser to fill the room or put just a few drops on a washcloth or cotton swab placed near the birthing woman. Make sure the scent is acceptable to your patient first, because some women will have a strong aversion to certain scents. My go-to scents are lavender, which is relaxing, peppermint for nausea or to cover unpleasant smells, clary sage to promote labor when things slow down, and citrus like orange, grapefruit, or lemon to help re-energize women when they are tired and need a boost. Encourage your patient to eat small amounts of nutritious food throughout her labor to keep her strong, and offer sips of water regularly to keep her hydrated. Another intervention to help a woman relax during labor is gentle massage and touch. Hand and foot massages are nice, as well as gently stroking her head, back, and arms. Remember though, some women do not like to be touched during labor, so please ask what she prefers. Rhythm, ritual, breath, and voice work are all important labor management tools. Many laboring women will find a movement or a sound that helps them get through a contraction. Some examples might be swaying their hips, tapping a foot or leg, snapping, or repeating a phrase or sound during a contraction. These repetitive rhythms can be a distraction from the pain. If you notice a woman doing these earlier in labor and that it's helping her cope with contractions, encourage her to continue with this motion or sound as the contractions become more intense. In this way, she's creating her own supportive ritual. One of my favorite breathing techniques is telling the woman to blow out the candle. Pretend your finger is a candle, and you instruct her to breathe in through her nose and blow out your candle. And then you can count to a certain number to help her ride her contraction to the top and back down. So it goes something like this. All right, here we go. I want you to blow out my candle. Breathe in, blow it out, 1. Very good. Breathe in, blow it out, 2. Breathe in, blow it out, 3. Good, you're almost there. You're almost done with your contraction. Breathe in, 4. Breathe it out. And then I will always tell the woman to start and end her contraction with a cleansing breath. So like an ocean wave. When in pain, many women will hold their breath or cry out with a high-pitched sound. Instead, encourage her to use low sounds from the back of the throat, which will keep her jaw relaxed and help labor progress with less tension. Now we will discuss one of the most important interventions in labor support, position changes. Movement promotes progress during labor, and change is good. Remember, there are no wrong positions in labor. Here are some examples. Walking can be particularly helpful during early labor. Slow dancing or leaning on a partner or midwife. Note how my husband is supporting my heavy belly, which felt quite nice. Side lying. Leaning over the bed with pillows propped up. Or birthing ball. Leaning over a sling, or just a countertop. One-sided lunges can be particularly helpful for babies you suspect might be in an occipital posterior position. Squatting, either independently or supported by a stool or partner. Kneeling. Or sitting. As you know, many women experienced back pain during labor, so here are some techniques that can help. The double hip squeeze is performed by placing the heel of your hand on the iliac crest of the pelvis and holding steady pressure throughout the contraction. Look how the pelvic outlet widens when you perform the hip squeeze. Not only are you providing pain relief, but you help create more space for the baby to descend. Sacral counter pressure can be performed by using one hand on the woman's sacrum to push down and back during the contraction. You might also want to try using a rebozo, which is essentially a long piece of fabric with some stretch in it, but a sheet will do just fine. This is a technique called abdominal sifting. Spread the sheet evenly over the woman's belly. Make any necessary adjustments, and then lift up and sift side to side. Abdominal sifting can release tight ligaments and promote optimal fetal positioning. This next technique is called shaking the apples and is thought to be helpful in rotating a baby in an OP presentation by helping the mother relax her muscles. Finally, heat, cold, and water are great tools to use in labor.
Ready? So we've got a chucks, we've got a towel, and we're gonna get some hot water.
The heating pad can be very comforting in labor. You can place it on a woman's back, shoulders, or lower abdomen. Heather is using hot water from the coffee maker, but you can use the kettle as well. Be sure to check the temperature of the heating pad with your hand to make sure it's not too hot. A heating pad is a nice alternative to sitting in a tub if that's not an option for your clients.
Put some tape on it if you want so it stays its shape. That's it, that's your heating pad.
I really liked using a heating pad during my labor. Water or hydrotherapy is particularly soothing. If you don't have access to a tub, the shower can work just as well. When using a heating pad or the shower, be sure to occasionally check maternal temperature and pulse and the fetal heart rate. Discontinue use if mother or baby are tachycardic or if the mother has a fever. Use a fan to cool the room when the mother feels too warm, or try using a cold compress on her neck or forehead. This can be especially helpful during second stage when the woman is pushing and feels hot. Well, that concludes our presentation. Thank you so much for listening. Remember, every woman, every baby, every labor, and every birth is different. Hopefully, we've shared some labor support techniques and interventions that you can use to create a positive experience for the women you care for in labor at your clinic. We know your presence makes such a difference in their lives.